This is the story of Altered Haemodynamics, which takes us through to cervical arterial dysfunction. The authors are Alan, Taylor and Roger Kerry of Nottingham University. In the beginning, physiotherapy was largely about circulation, and treatments were very often related to circulation. And then we got really sophisticated and started to do manipulation and mobilization techniques. And our focus was primarily on the vertebral artery from a risk perspective. Then we got slightly smarter and we found that arteries could be injured. And some of these cases were written up in various journals, such as the British Journal of Sports Medicine. And we realised that vascular injuries could affect young, fit athletes. As part of this, we realised that blood vessels could also be a source of pain. And the source of pain is primarily from the nociceptors in the tunica adventitia. And again, the profile could be any group. So because we as physical therapists treat pain, this was of interest to us. We searched further through the literature. And we found a condition known as endofibrosis of the external iliac artery, which kind of changed the way sports physicians and sports physiotherapists were dealing with exercise-induced leg pain. Once again, the profile were young, fit athletes who were suffering exercise-induced leg pain. And there were ways in which we could assess this and identify it at a very early stage. Of course, it wasn't just the arteries that were involved. Deep vein thrombosis was thought to be something that would affect an older age group. Again, we found that deep vein thrombosis could affect young, fit individuals and sports people in particular. Steve Waugh, the Australian cricket captain, was one particular example. So again, the profile is any age group, and we also realised that there could be a pathogenesis from soft tissue injury through to deep vein thrombosis. New information for us. As we worked around the body, we realised that all areas of the body could be affected by vascular issues, and well known in medicine is the abdominal aortic aneurysm, which is a source of back pain, which we as physiotherapists should consider. And the profile here is 60-year-old plus males predominantly, but females could be affected as well. Of course, there are implications for us as manual therapists. We treat pain, so we need to be on the lookout for hemodynamics all around the body. And this was written up in various chapters in various books over the last decade. And what was key with regard to this was that the profile here could be any age group. We just have to have good clinical reasoning to be able to understand what's happening. Above all, the key thing was that there were implications for athletes, and that these implications would affect lower limb and also upper limb. So throwers, upper limb athletes such as cricket players, tennis players have all been implicated in these sorts of things. And there are ways in which we can assess and look for these things, but the key thing is to have an index of suspicion in the first instance. Of course, this journey took us to the neck, and it began actually in 1999, but we first started to write about vascular issues in the neck back in 2001, and questioned whether vascular assessment should be part of musculoskeletal examination. Of course, we've made the journey to the cervical arterial dysfunction and IFOMPT's recent cervical spine risk assessment framework, which was announced in 2012. And this contains an amalgam of lots of work from lots of experts all around the world who have put together this information and given direction for clinicians. So the important thing here, the journey has gone from a clinical conundrum through a research process, through a questioning process, and we've eventually ended up with some direction for clinicians here. We were originally using bad science. We were using tests that weren't really reliable and pinning our clinical decision making on them. Now we've got a much more robust framework by which to assess our patients. Some of this work was done at the University of Nottingham, which is a great place to be. We're always happy to have feedback, and there are the details. You can contact either Roger or myself via any of those methods there.